Hello everyone, I'm Dr. Raghu Nagaraj, the Director, Department of Orthopedic Sports Injuries and Joint Replacement at Kauvery Hospitals, Maratali. I'm here to talk about our latest advanced technology in the joint replacement, that is Mako Smart Robotics 2.0. So this robotics has helped us to achieve the best possible outcomes in our joint replacement surgery. So when we talk about robo, the advantage of robotic joint replacement surgeries are less pain after the surgery, faster recovery, and when we realign the leg back into its position, the accuracy is as normal as possible. So I want to explain how the robotics works in the joint replacement surgery. What we do first when the patient comes to us with a severe knee arthritis in the OPD is, once we diagnose them and advise knee replacement surgery, we do a CT scan of the patient's limb from the hip to the ankle joint. And that CT scan is fed to the robotic computer. So this is the computer of the robotics. Using this computer, we can assess the deformities and the damages that is there in the patient's knee, and also how to get it back to as normal as possible. I'll show you here. So first thing is the case planning. Before surgery, we plan the patient's surgery in detail so that we can get the patient specific surgery done as close to normal as possible. So we will load the CT scan to the computer and we will get the planning done. So when we get the planning done, so we will know which implant suits the best fit onto the patient's knee. So this is the patient's knee CT scan in a 3D view. Using this view, we can align the patient's implant as close to normalcy so that it can mimic their native knee as close to a normal as possible. And the accuracy of this computer is so much that it gives us the accuracy to the closest normal, like less than 0.5 mm in laxity and also less than 1 degree in angles. So using this accuracy, we can precisely plan the patient implant positioning so that that fits to the patient knee as possible. Once the case planning is done, while doing the surgery, we can again assess the patient's knee, how the implant is. You can see this 0.5 mm. You can assess the laxity, the medial one, that is inner knee laxity, and the outer knee laxity in both the knee bending and the knee straightening is possible. So using this computer, we can recreate the patient's knee to as normal as possible. That is the advantage of the robotic pre-operative planning. Once the planning is done, then we execute the surgery using our robotic arm. So this is the robotic arm. So using this handle, we reshape the ends of the bone, both the thigh bone and the leg bone, and put the new implant onto the edges of the bone. So this is the tool in our surgeon's hands to get the best possible outcomes in our joint replacement surgery. So this will be in our control. It doesn't work independently, but yes, it gives us the precise planning and the mapping. When we are reshaping the bone, it is restricted only to the mapping that is done with the computer. We cannot cross the boundary that is set by the robotic computer. So this advantage of this technique is we cannot cross the boundary, and that will help us to prevent damages to the normal structures. So that will bring down the pain after surgery to as minimum as possible. So using this robotic arm will reshape the bone to the normal precise level, and we put the implant into the positioning. So using this robotic arm, we are able to achieve the best possible outcomes in all our joint replacement surgery. To add to the feature of this robo, this is the only robo as of now which supports 3 types of joint replacement surgery: total knee replacement, partial knee replacement, and total hip replacement. This is the only robo in the world as of now to support all the 3 surgeries. So that's as an advantage, so that it can increase the horizon of the joint replacement surgeries. So using these robotic surgeries, our patient experience in joint replacement surgeries is been very great. Patient feels less pain after the surgery. They are able to walk within 2 to 3 hours from the surgery, what we call as a 0-day mobilization. So that helps in bringing down a lot of complications of joint replacement surgery. And also the downtime recovery period is reduced to as minimum as possible. Most of the patients will be able to independently walk within 3 weeks, and some patients, they even do go back to their driving 4-wheelers and all within 3 to 4 weeks period. So this Mako 2.0 robotics is the latest advanced tool in our hands to make the joint replacement surgery experience easy, pain-free and with faster recovery period. Thank you.